Are you aware that colitis and other inflammatory bowel diseases affect over 1.6 million Americans? That is an incredible amount of people, and every single one of them should have the opportunity to live better. Colitis is an unrelenting enemy that can ruin any part of a person's day. However, what if you were able to reverse the situation and take back control? We share the best ways to not just manage but also permanently overcome colitis symptoms in this captivating video. We are here to support you at every turn as you embark on your journey towards wellness. We are going to decode the mysteries surrounding colitis and provide you with the means to thrive. This thorough guide covers everything, from identifying the underlying causes to making realistic lifestyle adjustments. Your stomach may ache. The diarrhea doesn't go away. You also don't feel like eating. These are obvious symptoms of colitis. But which kind exactly? The word colitis refers to inflammation of the large intestine. Ulcerative colitis is just one of the numerous causes. That's an example of inflammatory bowel disease, IBD. Ulcerative and general colitis can have similar symptoms. You may be unable to distinguish between them on your own. This is where the role of your physician is relevant. They have the resources to assist you in determining the most appropriate diagnosis and course of care. Colitis could appear as an acute or chronic inflammation of the colon's mucosal lining. Worldwide, the prevalence of colitis is rising. Different types of colitis, however, can arise from a variety of mechanisms, such as infection, ischemia, autoimmunity, and medication use. Moreover, it could develop as a result of radiation exposure or immune system deficiencies. There are different types of colitis, and each type is identified by its distinct cause. With the knowledge of each type comes a unique understanding of its management. There is pseudomembranous colitis. Clostridium difficile is a particular type of bacteria that typically causes this kind of colitis. This type of bacteria is typically found in the intestine, but because good bacteria balance it out, it doesn't cause any issues. Naturally, existing bacteria aid in digestion and preserve the health of the colon. Healthy bacteria are destroyed when antibiotics like penicillin, fluoroquinolones, clindamycin, and cephalosporins are used. The alteration of gut flora heightens the likelihood of other pathogenic bacteria infiltrating or proliferating, particularly Clostridium difficile, which causes pseudomembranous colitis. Also, there is allergic colitis. Nursing infants are affected by allergic colitis. Food intolerances are the cause of it. These include lactose intolerance in dairy products and soy milk allergy in soy products. Through their breast milk, nursing mothers give their babies access to the proteins they consume, giving room to the possibility of these infants being affected by allergic colitis. Intestinal ischemia syndrome, or inadequate blood flow to the intestines, can result in ischemic colitis as a side effect. Any area of the colon may be affected by ischemic colitis, but the left side of the abdomen is typically where the pain is felt. There are different degrees of ischemic colitis. Colon healing typically occurs naturally without the need for active care. An additional form of inflammatory bowel disease is called microscopic colitis. It is linked to other autoimmune diseases, but not to Crohn's disease or ulcerative colitis. As the name implies, to detect any signs of this type of colitis, your doctor must use a microscope. There are primarily two types. When a protein called collagen accumulates in your colon, it can lead to collagenous colitis. Colon inflammation caused by a layer of white blood cells called lymphocytes is known as lymphocytic colitis. One of the two disorders under the umbrella of inflammatory bowel disease is ulcerative colitis and Crohn's disease. This kind of inflammatory bowel disease results in persistent inflammation of the large intestine's inner lining as well as sores or ulcers. The rectum is where ulcerative colitis typically begins and progresses through the left side of the colon. However, some people's colons, either entirely or mostly, are affected by colitis. It is known as pancolitis or extensive colitis. The most often diagnosed form of colitis is ulcerative colitis. It happens when the immune system overreacts to substances found in the digestive tract, including bacteria, but the exact cause is unknown to experts. Another form of inflammatory bowel disease called Crohn's disease includes Crohn's colitis as a symptom. Any area of your digestive system, from your mouth to your anus, can be affected by Crohn's disease. There could be healthy tissue in between inflammatory areas, unlike with ulcerative colitis. Even though receiving a colitis diagnosis can be troubling, it's a crucial first step toward feeling much better and leading a better life. It's critical to remember that everyone is affected by colitis differently. No two people with colitis experience the illness in precisely the same way, and symptoms can range from mild and infrequent pain to frequent and severe pain. The symptoms of colitis can also vary with age. When symptoms in children are so subtle, there is a risk of serious consequences. Because unnoticed symptoms are usually unmanaged, hence may interfere with a child's normal development. To varied degrees, you might experience any or all of the following symptoms. Colitis patients often have watery diarrhea, blood in their stool, fever, unexpected weight loss, abdominal pain, and an excruciating ongoing urge to pass gas in their intestines. Several strategies can help manage colitis symptoms effectively. Here are 5 best approaches to managing colitis symptoms. Number 1. Approach. Make dietary changes. Think about following a low-residue diet. If your symptoms are severe or acute, a low-residue diet is easier to digest. It prioritizes soft, properly cooked foods while limiting fat and fiber. You might want to consider adopting a low-residue diet if you have radiation colitis or a transient infection. Also, take into account an anti-inflammatory diet. A diet high in sugar and fat, especially processed and fast food, should be avoided if you want to maintain low levels of chronic inflammation. To reduce inflammation, opt for healthier unsaturated fats such as those found in nuts, avocados, oily fish, and olive oil. Inherently anti-inflammatory is the Mediterranean diet. Another dietary modification you can do is the elimination diet. An elimination diet could assist in identifying the foods that trigger flare-ups in your inflammatory bowel disease symptoms. With an elimination diet, you cut out specific food groups and gradually reintroduce them to see how your body reacts. With the knowledge you gained from the short-term elimination diet, you can create a customized, long-term maintenance diet. It is possible to lessen inflammation and control symptoms by avoiding trigger foods like dairy, caffeine, spicy cuisine, and high-fiber foods. Number 2. Approach. Use of medication. To help reduce inflammation and symptoms, your doctor may prescribe anti-inflammatory drugs, immunosuppressants, or antibiotics. Immunomodulators to suppress your autoimmune response, corticosteroids to treat inflammation, antibiotics to treat infections, and aminosalicylates to treat inflammatory bowel disease. Number 3. Approach. Stress management. Since stress can worsen symptoms, stress management can be a useful strategy for managing colitis. Reducing stress levels can potentially result in fewer flare-ups and improved overall management of the condition. Methods like mindfulness, deep breathing, and therapy can help achieve this. It's critical to determine what stress management strategies are most effective for you and to integrate them into your everyday activities. Number 4. Approach. Regular exercise. For those with colitis, regular exercise can be an important part of the treatment regimen. Exercise can make life better and more active for those with colitis by enhancing gut health, lowering inflammation, easing stress, and enhancing general well-being. As usual, before beginning any new fitness regimen, it's crucial to speak with a healthcare professional, particularly if you have any underlying medical issues or concerns. Number 5. Approach. Regular monitoring. Consistent monitoring is crucial for the effective management of colitis because it enables medical professionals to monitor for nutritional deficiencies, assess quality of life, detect complications, assess disease activity, assess treatment response, and empower and educate patients. You may better manage your condition by identifying triggers and patterns by keeping a record of your symptoms, food, and lifestyle choices. People with colitis can receive individualized care and support to maximize their health and well-being by closely monitoring the condition and collaborating with healthcare providers. Colitis management necessitates a thorough strategy that takes care of the illness's mental and physical components. People with colitis can effectively manage their symptoms and enhance their quality of life by combining a variety of strategies customized to meet their specific needs. The 5 strategies mentioned in this video are the most effective for managing colitis. It is possible to successfully manage colitis and lead a satisfying life with commitment, tenacity, and support. Thanks for watching. Don't forget to give this video a thumbs up, share, and leave us your thought in the comment section below. Kindly subscribe to our channel for more videos like this. Until next time, stay healthy.